Welcome to Angel Health Academy. Topic for the day or topic for the session is Comprehensive Primary Health Care. CPHC, Comprehensive Primary Health Care. Comprehensive Primary Health Care or CPHC is a holistic approach to the health care or health care delivery services. So comprehensive primary health care means it is a holistic approach. It covers all the aspects of the health. Okay, so it is a holistic approach to healthcare that addresses, that covers the majority of an individual health needs. So the almost all the health needs, both general specific needs of an individual throughout their lives. So it covers all the health needs of the people throughout their life. Because of that it is called comprehensive. Because it covers all the aspects of physical, mental, social, spiritual, economical, that comes a comprehensive. Okay, so comprehensive dimension. Comprehensive primary health care is a holistic approach to the health care or health care delivery services that addresses, that includes, that covers the majority of an individual health needs and health problems throughout their life. Then it encompasses or it emphasizes prevention, promotion, treatment or curative services, rehabilitation services and palliative care services. So it includes preventive services or it emphasizes preventive services, promotive services, curative services, that is nature of treatment, rehabilitation services and even palliative care services or end stage services. And it is delivered in a manner that is accessible to all the people in the community. Accessible means available. All the remote people or the people those who are staying in the remote area of the community also may be accessible this particular services because it is a door-to-door services. Primary health care itself is a door-to-door services. So that is accessible and acceptable. It can be acceptable at any section of the community. So it is a general and basic health services or essential health care. It can be acceptable by all the section of the community. All the different religious people or different people with the different cultural practices can be accepted. Okay, and it is affordable. Of course, the most probably it is free of cost. So it is affordable. So these services, comprehensive services are delivered in a manner that is accessible manner, acceptable manner and affordable manner. And in addition to that, the comprehensive primary health care is a high quality services. So it maintains high quality and high standards of health care or community health nursing services. Thus, it encompasses or it emphasizes the prevention, promotion, treatment, rehabilitation and palliative care. And it is delivered in a manner, okay, in a pattern that is accessible, acceptable, affordable and with high quality services. So it maintains the quality assurance. Then comprehensive primary health care package will also include nutritional services, geriatric health care services, palliative care services and other rehabilitative care services. So it is a package of services. In the last section of the presentation I will be explaining about the 12 different package of services comes under comprehensive primary health care. So comprehensive primary health care package will also include nutritional services, geriatric health care services, palliative care services and even rehabilitative care services. Then CPHC often involves collaboration. So always they coordinate, collaborate and cooperate with between the various healthcare professionals, healthcare personnel or health workers and various healthcare agency or organization or healthcare sectors such as PHC, sub-center, community health center, subdivisional hospital, district hospital, etc. and even with the voluntary agencies, etc. So they collaborate between various healthcare professionals and organization. Even they collaborate with the indigenous system of medicine such as Ayush. So collaboration between various healthcare professionals and organizations to provide integrated care that includes preventive, promotive, curative, restorative, rehabilitative, palliative care, etc. Okay, everything comes under integrated care that is tailored to according to the needs of the individual and according to the needs of the communities. Thus, comprehensive primary health care often involves collaboration between various healthcare professionals and various health services organizations in the community to provide integrated healthcare services that is tailored, that is in relation to the needs of the individual and the communities in that particular area. The next is beginning of comprehensive primary health care. Beginning of comprehensive primary health care. As you know that primary health care Government of India introduced in 1978 in Alma-Ata Declaration. I have been already uploaded a video of primary health care with all the details. If you have not seen, please refer and see that particular video for the complete information of primary health care. In this class, we are going to discuss about, or we are discussing about, the comprehensive primary health care. So later in 2018, Government of India modified primary health care, or 2018 onwards, Government of India modified primary health care as comprehensive primary health care. That means Government of India made more comprehensive under Ayushman Bharat scheme, or under Ayushman Bharat. So Ayushman Bharat is a national health care scheme launched by Government of India in 2018. So primary health care is modified as comprehensive primary health care in 2018 with the introduction of Ayushman Bharat scheme. So it comprises, that is Ayushman Bharat included two main initiatives. One is Pradhan Mantri Jan Arogya Yojana, that is PMJAY. First one is Pradhan Mantri Jan Arogya Yojana, PMJAY, and second initiative is Health and Wellness Centers, that is HWCS, Health and Wellness Centers. So under Ayushman Bharat from 2018 onwards, in Health and Wellness Centers, Government of India introduced comprehensive primary health care than primary health care. So let us discuss in short about the Pradhan Mantri Jan Arogya Yojana and the Health Wellness Center, the two main initiatives of Ayushman Bharat. First one is, the first initiative was, or first initiative is PMJAY, which aims to provide health insurance coverage to over 50 crore people, those who are economically vulnerable individuals and families in the country. So the first initiative is PMJAY, Pradhan Mantri Jan Arogya Yojana, aimed to provide health insurance coverage to over 50 crore population who are economically vulnerable individual or families in the country. Thus, under PMJAY, the beneficiaries, the people can avail or will get cashless treatment. So, they will get the treatment without paying any cash in the hospital for hospitalization expenses up to 5 lakhs rupees per family per year. Okay, in each family, those who are comes under this particular scheme will get 5 lakh rupees per year per family for any secondary and tertiary care services in the hospital. Okay, so secondary and tertiary care hospitalization can be or could be done cashless without giving any cash to the hospital under this scheme, that is Pradhan Mantri Jan Arogya Yojana. So with this scheme, or those who are beneficiaries comes under, who are economically vulnerable people who comes under this scheme will get rupees 5 lakhs per year per family for the hospital administration, that is especially for the secondary care and tertiary care. I have already uploaded a video with the primary, secondary and tertiary care level. Okay, you can also watch that video to get more knowledge about the what is primary level care, secondary care and tertiary care. Then the second initiative of Ayushman Bharat focuses or focused, okay, concentrated on strengthening the primary health care through establishment of, through starting or building of health and wellness centers, HWCs. Okay, so we are already said that Ayushman Bharat have two main initiatives. First one is we have already discussed regarding PMJAY scheme. Second one is that is strengthening of the primary health care and health centers by replacing the health centers like sub-centers, primary health center, community health center as health and wellness centers. So these health wellness centers aim to provide, all these health and welfare centers under Ayushman Bharat provide comprehensive primary health care services, CPHC, that including already we have discussed such as Preventive, Promotive, Curative, Rehabilitative and Palliative care services. So all these services are added to primary health care. Then Government of India modified primary health care as comprehensive health care with the second initiatives of Ayushman Bharat, that is converting the present or then health centers as health and wellness centers. So this is the beginning of comprehensive primary health care in India from 2018. Then third one is concept of comprehensive primary health care or components of comprehensive primary health care. So next one is concept or components of comprehensive primary health care. The WHO, World Health Organization, defines comprehensive primary health care as with three components, as it consisting three components. So according to WHO, comprehensive primary health care includes three components. First one is meeting people's health needs comprehensively. So people have many general and specific needs, but that is meeting by the health centers or government through primary health care. That is comprehensive primary health care. That is comprehensively all the aspects of the health needs: physical, mental, social, spiritual, economical, political, etc. All the dimensions, psychosocial dimension, would be met by comprehensive or making comprehensive of primary health care. So meeting people's health needs comprehensive is the first component of comprehensive primary health care according to WHO. The second component of comprehensive primary health care according to WHO is systematically addressing, systematically covering or including all the determinants of health. Determinants is nothing but the factors which influence the health of the people. Okay, for example, our age, sex, etc. Okay, biological health. Okay, our healthy practices, our habit, all comes under determinants of health. I have been already uploaded a video, determinants of health. So you can watch that video also if you have not seen or if you have not know what is the determinants of health, etc. So second component is systematically covering or addressing all the determinants of health of the individual in the community through comprehensive health care. Then third component of comprehensive primary health care according to WHO, that is empowering individuals. Empowering individuals means educating the individuals or family or community, okay, through IEC, information, education and communication. So empowering means educating, health education. Okay, so empowering all the individual to take a decision themselves during their healthcare services. Okay, and develop healthy practices to prevent and control the occurrence of any epidemic or any diseases. Okay, then practice the self-care for the family members. All comes under empowering individuals. So these are the three important components comes under comprehensive primary health care according to World Health Organization. So World Health Organization defines comprehensive primary health care as first is meeting people's health needs through comprehensive, promotive, protective, preventive, curative, rehabilitative and palliative care throughout their life course. So all the needs throughout the life course or life stage or developmental cycle, okay, of all the individual, family or community would be met with the comprehensive primary health care. So that includes integrated services, that is comprehensive, promotive, protective, preventive, curative, rehabilitative and palliative care. Then second point we are already discussed, that is systematically addressing or meeting the broader determinants of health of all the individuals and families and communities in the particular area. Third one is empowering the people, empowering the individuals, empowering the families or citizens through IEC, that is information, education and communication. Thus people will participate, people will take care themselves, okay, to prevent and control various problems. So that is empowering individuals, family or community through IEC by giving health education. Next is the goals of comprehensive primary health care. Now you know what is comprehensive primary health care. Now we are going to discuss what are the important goals or aims of comprehensive primary health care. First one is increase the access of essential health care to the public or to the people. Okay, increase access. We are already discussed in the introduction section. Access means making availability. Okay, so every people in the community can avail, can get. Okay, or they may cover under comprehensive health care. So access means that ability to receive, okay, or avail the services. So we have door to door or doorstep services. All the health worker visit the community during their home visit. That is door to door care services. Thus there is an increased access. In every village there is a primary health center, sub-center, health and wellness centers. Okay, so increase the access of essential care. And second is improve the quality and efficiency of primary care. So basic care, the quality and efficiency of the primary care to be improved. Okay, quality and standards has to be maintained, which ultimately, okay, completely is intended to achieve better health outcomes at lowest cost. So as you know that Government of India, we have very less GDP to spend for the health services. Okay, so we have to get maximum services with limited cost. That is called better health outcomes. Good quality health services with less cost or budget. That is better health outcomes at lowest cost. So these are the goals of comprehensive primary health care. First one is increase access to every people, okay, to get the comprehensive health care. Second one is increase the quality and efficiency of the comprehensive primary health care. The last one is ultimately intended, okay, the overall goal of comprehensive primary health care is to achieve the better health outcome, means better health services, better health and well-being of the people by spending less money, okay, health economics at the lowest cost. Okay, next is organization of comprehensive primary health care. Organization of comprehensive primary health care. Comprehensive primary health care is organized at 3 levels. Okay, one is family level and community level. Family and community level. That is in the family. Okay, at the doorstep of the family, in the remote area. Okay, underserved rural area and urban area, or slum area, etc. That is in the family and the community level. Second is health center level. That is health and wellness centers. So health and wellness center level. And third one is referral hospital level. That is first referral level. That includes a community health center, subdivisional hospital and district hospital. That is a referral, first referral level. Okay. So organization of comprehensive primary health care is done at 3 levels. That is family and community level, health and wellness centers level and first referral unit level. So first one is family and community level. Here family and community receive the comprehensive primary health care. Okay. From the health workers, healthcare personnel or health workers during their field visit and home visit. That includes preventive, promotive, curative, palliative and rehabilitative care. Okay, that was delivered or that is delivered as close to the people where they live. That is their home, okay, and their community or their ward or in that field, okay, that particular community. So first level is family and community level, where they avail or receive comprehensive primary health care, that is preventive in nature, promotive care services, curative services, palliative care services, rehabilitative care services, etc. Then second level is health center level, that is health and wellness center levels. That is sub-centers, primary center, urban health centers is strengthened under Ayushman Bharat scheme as health and wellness centers. So in second level comprehensive services avail at health and wellness centers. So people can avail all the comprehensive health services, all these preventive, promotive, curative, palliative, rehabilitative services from the health and wellness centers. Okay. Then third level is first referral level. That means comprehensive primary health care as general medicine consultation at PHC and urban primary health center. So primary health center and urban primary health center people receive a general medicine consultation in the OPD sessions. Okay. Then special consultation and first level hospitalization is available as referrals from the health and wellness center. Okay. People are referred from health and wellness center to the first referral unit, that is CHC, community health center, then subdivisional hospital, then district hospital, etc. So for the general consultation and special consultation is available at and first level hospitalization is available at rural and urban community health center, then subdivisional hospital in the sub-district level and district hospital in the district level, where they avail comprehensive primary health care as a referral services. That includes general medicine consultation and OPD services at PHC and urban PHC, special consultation services in both OPD and IPD, and hospitalization or hospital admission at community health center, subdivisional hospital and district hospital. So these are the 3 levels of organization of comprehensive primary health care at family and community level, that is at community, and health and wellness center level, that is at health center, and first referral level, that is first referral unit level, such as PHC, UPHC, CHC, SDH and DH. Next is key principles of comprehensive primary health care. So comprehensive primary health care rendered based on certain set principles. That principle is called key principles of comprehensive primary health care. So the key principles of comprehensive primary health care includes 8 principles. So well, I think you are remembering that primary health care principles. There were only 5 principles. Okay, primary health care: equitable distribution, multi-sectoral approach, community participation, focus on preventions, intersectoral coordinations. Here government is added some more principles with the principles for comprehensive primary health care. So here there is 8 different principles for comprehensive primary health care. That is, first one is accessibility, second one is comprehensiveness, third one is coordination, fourth one is community participation, then fifth one is long-term perspective, and sixth one is equity, then seventh one is sustainability, then eighth one is intersectoral. So these are the 8 important principles or key principles of comprehensive primary health care. In that we have community participation, equity, you might have heard about the equitable distribution, intersectoral coordination, all were the previous principle only for primary health care. Okay, now we have modified with the 8 principles, that is accessibility, comprehensiveness, coordination, community participation, long-term perspective, equity, then sustainability and intersectoral coordination or convergence. So let us discuss in brief about the principles of comprehensive primary health care. First one is accessibility. We are already discussed what is access or accessibility. So comprehensive primary health care should be geographically accessible. So anywhere in the community people should access or avail these services. Okay, facility would be there in their own community. Okay, so that means comprehensive primary health care should be geographically accessible to all individual equally. Okay, all individual, ensuring that essential health care services, basic health care services are within the reach of their home, okay, or community without undue hardship. So they should not get any difficulty to come and get the services. It has to be go to their own area, their own doorstep, etc. So easily it should be availed and conveniently without any difficulty by the public. That is the meaning for within the reach. Okay, and without undue pressure or hardship. Okay, so accessibility is nothing but making access of comprehensive primary health care everywhere in the community, both in urban and rural area, underserved remote area, both in rural and urban area. So comprehensive primary health care should be geographically accessible to all the individual and people in the community within their reach without any difficulty. Okay. Then second principle is comprehensiveness. Now you know that we added a comprehensiveness for primary health care, that is become comprehensive primary health care. So it encompasses or it emphasizes a wide range of services. There are many services, okay, wide range of services that addresses not only the physical health but also mental health and social well-being. That means this includes preventive, promotive services, treatment for all acute and chronic conditions, okay, that's treatment for all minor ailments, okay, then rehabilitation services and even palliative care service. Like that it is comprehensive, okay, because of that it is called comprehensive primary health care. In the introduction part we already discussed the integrated services. That means it includes preventive, promotive, curative, restorative, rehabilitative, protective and palliative, okay, etc. All comes under, that is wide range of services. That is called comprehensive services. Third principle is coordination. So comprehensive primary health care promote the integration and coordination of all health services across the different levels of care, such as primary care, secondary care and tertiary care, and among various health care providers. You know that in community level there are many health care providers at sub-center level, at PHC level, at community health centers level, okay. So a multi-purpose health worker, auxiliary nurse midwife, then health assistant male, female, like that, medical officer at PHC and CSC, etc. There are different or various health care providers, and they provide different primary care, secondary care and tertiary services. So all these services are integrated and given with the coordination, with the coordination and support, cooperation. All this care is given with the coordination and cooperation under comprehensive primary health care. So there is a Mutual relationship between the healthcare providers at primary level, secondary level and tertiary level. This is the third principle. Then fourth one is the same previous principle, that is community participation. So it encourages active participation of all the individuals and community in decision making that affect their health. So whenever there is a problem in the family or the individual, they have to take keen interest in decision making of their own health care. That is the meaning of active participation in health services. So comprehensive primary health care encourage, motivate, active participation of all the individual and communities in decision making about their health problems and health plan and implementation and evaluation services. That is family health services. So their decision making in their family health services. This involvement helps tailor the health services to local needs and preferences. So when the family members or when the individual are participated in decision making, then the healthcare services will become as per their local needs and as per their preference and perspectives and their likes. When they participate in the decision making, they know that what is their need, what is their local problems and what is their preference, etc. can be fulfilled or to be solved. So this involvement helps tailor health services to according to their local needs of that particular community and according to the preference of the community. This is about community participation. The fifth principle is long-term perspectives. So not only a single care or for a short period, comprehensive primary health care focuses the long-term care. So comprehensive primary health care focuses on promoting health and preventing diseases over a long period, over a long term, rather than just treating the illness after they occur. Not simply a curative services for an infectious disease or outbreak. It lasts for a long period for throughout the life of the individual and the community people or the family. So it is a long-term care services. That is a long-term vision or long-term perspective. At long-term perspectives or long-term vision, it includes all the health promotion activities. So comprehensive primary health care includes health promotion activities, and it also cover all the social factors which influence the health of the individual, family and community under comprehensive primary health care. So fifth principle is a long-term perspective or long-term vision to render the comprehensive services for a long period, that is throughout the life of the individual or family. Then sixth principle is equity. I think you are still remember the principle of primary health care, that is first one is equitable distribution. So same equity. So equally rendering the health services. Comprehensive primary health care strives to ensure that all individuals have access of comprehensive primary health care or basic health care to the same quality of care, regardless of their socio-economic status, their ethnicity, their gender or geographical location. So whether they are in rural people or whether they are in urban people, whether they are male or whether they are female, whether their ethnicity color is black or white, whether their economic status is poor, upper class, middle class or lower class. Nothing considered, without discrimination. The comprehensive health care services has to be rendered equally to all the individuals, all the people, all the family in the community, like same quality of care. There is no difference there is no changes or variation in quality of the care that is rendered to the different people in the community. Everybody will be accessed equal and quality and standardized comprehensive primary health care. Thus, it aims to reduce the disparities in the health outcomes. So disparities of health outcome means some people will get improved or programs will be good and some people is bad because of the quality of the services. Here in comprehensive primary health care, everybody is getting same standardized quality services. So all will get the same prognosis and outcome. All will be get relieved from the problems in the same manner or in the same way. That is, it aims to reduce the disparities in health outcomes, and more than that, it achieves the social justice. Social justice is nothing but giving equal to all the people who are in the society. So without any discrimination, comprehensive health care has to be rendered to all the people in the community. And in addition to that, the care will be given to the community people. All the community people will be the same quality in nature. That is, the same quality of care should be equally given and everybody should have access for that. That is about the principle equity. The seventh principle is sustainability. Seventh principle is sustainability. Comprehensive primary health care system are designed to be sustainable. So it is designed, it is prepared, okay? It is formulated with a sustainable design, okay? Taking into account factors such as cost effectiveness, efficient use of resources, and the capacity to respond to changing health needs and challenges. So comprehensive primary health care developed and designed as sustainable. So some factors are considered to maintain the sustainability. One is cost effectiveness, that is less budget, maximum effect, that is cost effectiveness. Effect is more than the cost, that is cost effectiveness. Then efficient use of available resources, that is man, money, material and community people. So according to the significance of the need, maximum utilization of the available resources, that is efficient use of resources. What is required we are rendering, that is efficient use. Then efficient use of the capacity to respond to the changing health needs and challenges. So always in the community, health needs will be changed, health problems will be changed, health demand will be changed. So that is the health challenges to the health workers. So according to different challenges, according to the different needs, healthcare authority has to be responded. For that they should be strengthened. Okay, healthcare manpower should be strengthened. Their capacity has to be increased. Their quality has to be increased. That comes under sustainability. So in short, comprehensive primary healthcare system is sustainable. It is planned and designed as sustainable with the factors considering like cost effectiveness, efficient use of resources and capacity in relation to, in association to changing the health needs, the different health needs of the public and the health challenges of the community and the society. The last principle is intersectoral approach or intersectoral coordination. This is the same principle we have discussed with the primary health care. So health sector alone cannot provide health services. It needs cooperation and collaboration with other health related sectors. So though there are many sectors, there are other sectors such as education, housing sector, employment sector, transportation sector, water authority, food and agriculture, animal husbandry, etc. So comprehensive primary health care recognizes, understand that health is influenced by social, economic and environmental factors. There are many factors already we said, determinants, that comes under social, economic and environmental factors. Thus comprehensive primary health care may involve collaboration with other health related sectors such as education, housing, employment, etc. to address the underlying determinants of the health. So education sessions involve in the empowering the people by giving health educations. Housing session or housing sector will provide healthy living of the people like construction of healthy house. Employment department will provide the opportunity for the employment of the people in the rural area and urban area. Thus it may help to improve the economic status of the people in the community. Thus they can avail more health services. Okay, so intersectoral approach or intersectoral coordination is nothing but health sector may have the collaboration and the cooperation with the other health related sectors to render the comprehensive primary health care and to meet the social, economic and environmental factors which influence the health needs and the health problems of the people. For example, education department, housing department, employment department, food and agriculture department, animal husbandry department, water authority, etc. So these are the 8 principles of comprehensive primary health care. Then the important part of the video is the 12 packages envisaged under comprehensive primary health care. In the beginning session I said that there are 12 packages that is introduced in comprehensive primary health care from the previous primary health care. So let us discuss about what are the or which are the 12 different packages envisaged under or covered under comprehensive primary health care. So here there are many pictures and I have been given that information to the pictures. So you can have a summary about the 12 packages, then later I explain one by one in detail. So first you see that the picture is related to pregnancy and childbirth. So first package of comprehensive primary health care start with pregnancy and childbirth. That is pregnancy and delivery, antenatal, intranatal, postnatal services. Okay, then after childbirth the second stage is the newborn, that is neonatal and infant, 1 year, that is infant. So second package is related to neonatal and infant. Then this infant will become child. So third package is childhood and adolescence. So third package of comprehensive primary health care is related to childhood services and adolescent health services. Then this adolescent become adult. Then the next service, fourth package is related to family planning and reproductive child health services. So reproductive child health services and family planning is the fourth package of comprehensive primary health care. Then fifth package is related to communicable diseases. So we have two packages related to communicable diseases. One is the management of communicable diseases by national health programs. So we have many national health programs. So by implementing national health program, Government of India trying to control and manage the communicable diseases. Second area of management of communicable disease, that is the sixth package of comprehensive primary health care, is by OPD services. So all the minor ailments has been treated with the OPD services by PHC, okay, that is Health Wellness Center, etc. So management of communicable diseases by OPD and hospitalization services. Then seventh package is related to non-communicable diseases. So you have to remember there are two packages, that is fifth and sixth is related to communicable disease only. One is by preventing and controlling those by national health programs. Second one is by providing direct OPD services at health and wellness centers. Then one is for non-communicable disease, that is the seventh package of comprehensive primary health care, is management of non-communicable diseases by screening, making early detection, screening, prevention and control. So management of non-communicable diseases by screening, testing, okay, investigating and using preventive and control measures. Then eighth package of services under comprehensive primary health care is related to ophthalmic and ENT services, that is ophthalmic and ENT care. Ninth is related to oral health care, that is basic oral health care. Okay. 10th is related to, as per the age, that is elderly and palliative care services. 10th package of CPHC is elderly and palliative care services. 11th one is emergency medical services. So casualty services, emergency medical services, that is 11th package of comprehensive primary health care. And last 12th package is related to screening and management of mental health problems or mental health illness or mental health ailments. So now in short you can see that many of the package of services related to stages of our life, starting with pregnancy, childbirth, neonatal infant, child, adolescent, then adult and RCH, that is reproductive child health and eligible couples. Then diseases like communicable diseases, two measures, non-communicable disease management, that is one option. Then other diseases such as ophthalmic and ENT services, oral health services, okay. Then elderly, same as per the age, as per the stages, that is elderly and palliative services. 11th one is emergency medical services, okay, that is different. Whenever emergency comes, it comprehensive health care provide emergency medical services. Then 12th one is screening and management of mental health problems or mental health illness or mental health ailments. So how to remember these 12 packages? In these packages, you know that is starting from the pregnancy, then childbirth. So like that you can remember. Okay, so pregnancy and childbirth, then neonatal and infant, then childhood and adolescence, then family planning, okay, with the RCH services, reproductive health services. Then the person will become adult. In that stage, it will be connected with the two communicable disease approaches or packages and one non-communicable disease management by early detection, screening and prevention and control services. Then comprehensive primary health care has three different specialty, that is ophthalmic, ENT and oral health care. Like that you have to remember. Okay. Ophthalmic and ENT together only, that is ophthalmic and ENT care. That is 8th package. The 9th package is oral health care. That is basic only. Okay. Basic oral health care services. Then 10th is the continuation of our stages, that is elderly care and palliative care. 11th is the separate, that is emergency medical services. And 12th is the screening and management of mental health and ailments. So like that you have to remember two communicable diseases, one non-communicable diseases, and other specialty ophthalmic and ENT, oral health care, then emergency, then special area also focused mental health ailments. Like that 1, 2, 3, 4, 5, 6, 7. Remaining all connected with the stages of the life. Okay. So let us discuss in detail about the 12 package of comprehensive primary health care with this clue and information. So the 12 package envisaged under comprehensive primary health care are, first one is care in pregnancy and childbirth, that is antenatal, intranatal, postnatal. Then second one is neonatal and infant health care services. So health care services for both newborn and infant. Then childhood and adolescent health care services. Third one is childhood and adolescent health care services. Fourth one is focusing mainly family planning. Okay, contraceptive services. So that is distribution of contraceptives and other reproductive health care services, that is RCH services. As you know that MCH is replaced by RCH. So reproductive health care services. So after adolescent health care services, you can remember reproductive health services. Okay, that includes family planning. Then management of communicable diseases by National Health Program, management of common communicable diseases with the outpatient care, OPD care for acute simple illness and minor ailments. That is a treatment for the acute simple illness and minor ailments with the standing order or standing instructions. Okay, so that you can remember management of common communicable diseases with the OPD care, that is outpatient care for acute simple illness and minor ailments. Then seventh package is screening, prevention, control and management of non-communicable diseases. We know that one measure is for packages for non-communicable diseases, that includes screening program, preventive measures, control measures and management. Then eighth package includes care for common ophthalmic and ENT problems. That is common ophthalmic and ENT problems will be treated or covered under or care is given under comprehensive primary health care. Then ninth one is basic oral health care to prevent the oral cancer and all. Oral health care also is the important care under comprehensive primary health care as ninth package of services. 10th is care for elderly, so elderly care or geriatric care and palliative health care services for the terminally ill patient, cancer patients, etc. So palliative health care services, that is elderly and palliative health care services, 10th package. 11th one is emergency medical services, especially for the burns and trauma, accidents, etc. So emergency medical services including burns and trauma, that is 11th package of services under comprehensive primary health care. And last one is 12th one is screening and basic management of mental health ailments or mental health illness or mental health problems. That is 12th package of comprehensive primary health care includes screening and basic management of the mental health ailments or mental illness. So these are the 12 packages of comprehensive primary health care or additional package included in the primary health care to modify the primary health care as comprehensive primary health care. So thanks for watching. Hope this video really benefits your studies and exams. If you feel it is really worth and benefit, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next and important academic video. Thank you.